Hey guys, I wanted to share with you how I prepared for clinical placements when I was a student. So this particular clinical placement, I was obviously on a respirology floor. So I printed off a few diagrams off of Google just in regards to the anatomy of the lungs, where I could auscultate. This was just a very easy visual reminder. Then I printed off a bit more information on anatomy of the lungs, where the sternum is, where the costal angle is, the lobes of the lungs, etc. So that was this page, and then I had my respiratory assessment all typed out. So subjective and objective assessment I had right there, just in case I was blanking out and I wanted to go and review this before seeing my patient. So essentially anything that I would kind of think I needed at some point during my clinical placement, I had printed off on here, just so it was very handy for me. I have more assessment charts and diagrams over here, different percussion sounds, different adventitious sounds. Over here I have a few different charts just in case I wanted to go over what affects oxygenation, interpretation of ABGs, the clinical significance of tachypnea. That I had all organized here just in case I needed it. It honestly just eased my mind so much. I have common medications, common treatment plans. I highly suggest spending a Saturday before your clinical, typing up a bunch of information onto a Word document, making it very easy for you to read and understand, include diagrams, include photos, make up charts for yourself. I think it really eases your mind, makes you a bit more confident going into clinical placements, and it honestly saved my butt. There were so many situations where I would go back into my papers, read everything over, and then everything just made a bit more sense while I was in my clinical placement. So I highly recommend doing this for yourself for whichever placement you go into, especially if it's a more specialized placement, so cardiology, respirology, neurology, maternity. Definitely do something like this. I think it'll just ease your mind a lot.